us Dr. G Dewan, who is the Director Health Family Welfare and Mission Director, National Health Mission, Chandigarh. So, sir, can you tell us what are the major initiatives have been taken recently to make healthcare delivery better?
See, Chandigarh is otherwise in healthcare, if you see the national level, it's one of the pampered cities, which is called in a lighter way, because in 114 square kilometer area, you are getting all the three levels of healthcare, that is primary, secondary and tertiary. The primary and the secondary level is taken care of by the Chandigarh administration, and tertiary level by the PGI MER. If we go by the census of the last census which was done, the population has been plugged at around 10.5-11 lakh, but in actual sense, with floating population, it touches around about 13 lakhs. We have around 26 allopathic dispensaries, another dozen of Ayush dispensaries, and by co-location of Ayush, you can understand Ayush carries Ayurvedic, homeopathic, Unanis. We are co-locating it with the allopathy, so that the patients willing to have any stream of treatment can avail that at the primary level, even on the secondary level. These dispensaries are located not more than a kilometer or so from the patient's residence. That means an alternative sector, there is a dispensary. In certain dispensaries, you are able to get two doctors, a gynecologist, gynecs also. These dispensaries not only give you the consultation, they examine you, diagnose you with the basic blood facilities, blood investigation facilities. They give you treatment free of cost, because under EDL, Essential Drug List, which is one of the innovations of the Government of India, one of the schemes of the Government of India under National Health Mission, we have to assure the patient of a basic minimum medicines which we give them free of cost. So a person of a poor strata, middle strata can come here, get the investigation done, get the clinical diagnosis done, investigation done, can get the basic medicines, and a referral can be done by the doctor to the next hospital, that is in sector 16, which is a secondary level hospital. Above all, these dispensaries have a promotive health also, like immunization is available. Under UIP, the immunization is available free of cost. RCH services, which take care of the mother and child in terms of pregnant mothers, their antenatal checkup, their pregnancy, their diet regime during pregnancy, their anemia component during pregnancy, and contraceptives are available. Now we give an injection contraceptive which is repeated after every 3 months. The mother does not have to take pills. The mother does not want to, can go, if she does not want to go for any of the other contraceptive method. So injection, which is to a government it costs, but to a patient it is free. These dispensaries are equipped with the malaria clinics. In case of fever, they are free free treatment is separate. Slides are made. But under one roof, you get all national programs. My doctor is well equipped because they have my doctor, my paramedics like LHV, ANM. They are well equipped with at the level stages of the knowledge of every program, which makes them a comprehensive primary health care. Earlier there used to be underneath dispensary is a sub-center. The innovation of the National Health Mission at UT level has converted these sub-centers into AMUs. Now in AMU, earlier in the sub-center you used to have one ANM and doing basic immunization work or something of this which is related with the mother or the child. But now you can get a doctor at the AMU level. Again, the services which are given by dispensary are taken care of by him. So we have come more closer to our patients. And in Chandigarh we have 4 hospitals, 500 bed which has been upgraded to 600 beds in sector 16. Earlier it was known as general hospital or district level hospital. Now it is renamed as a government multi-specialty hospital. The footfall of an average annual footfall comes to around 10 lakh plus only in the hospital as OPD patients. Around 30-40,000 patients as indoor. Round the clock emergency services are available. The Janni Sishu Suraksha Karyagram, which is again a national program in which the pregnant mother is brought free from home to hospital. Every expenditure is borne by the government. After delivery, she is left back to her place, and even the food which is given in the hospital is free of cost. Now this aspect you have to flag, this is going to bring your IMR and MMR on a lower side. Similarly, these services are made available in sector 22, 50 bed hospital, 50 bed hospital 45, and 100 bedded hospital Manimari. The southern sector of Chandigarh came little later, and there is a vertical rise of buildings. So the population number is more. So this hospital will cater to their needs.
Sir, don't you think we have so many initiatives of government is already running, but people may don't have that kind of awareness about it. We have so many initiatives of every region, Chandigarh region, even Government of India are running so many good programs to make healthcare delivery more accessible, more affordable. But some people may not have awareness. So what can be done on that front?
Yes.
It's a need of
See,
that.
I have been seeing after joining my services in 85 to 2018 today, or other way around, from an intern, medical intern to director health services today in the same city. My long pathway has shown me all things in black and white. In the last 3 years, what I can see is that what you said, people are not coming forward. People will come. The Government of India under National Health Mission has not only started giving you more of healthcare deliveries on the ground level, but at the same time are doing enough IEC activity to educate my patient, to educate the people who really deserve our services. In Chandigarh, 40% of the population, approximately 30% reside in urban slum colonies and another 10% in the UT villages, around 13 villages, and another 22 colonies are there. Now these patients, if you go on a survey with them, now they are well aware. Keep all the programs, because my Anganwadi worker, my auxiliary nurse midwife, that's ANM, my LHV, my area doctor, are giving them so much of information. Rather, it has become a consumer awareness market. They ask for the delivery. They ask for the service. And the way we are moving ahead, like the Bharat Sarkar has started with Ayushman Bharat, having an umbrella with two components. One is the wellness clinics. These dispensaries now will be upgraded to wellness clinics, in which we will be assuring them 12 services. Once we go for this, these dispensaries will be upgraded in itself. And under National Health Protection Scheme, which is going to be launched by the Honorable Prime Minister shortly, the survey of which will start from 30th, will make our patient at a grassroots level more protected with this insurance. He will have an inbuilt feeling that yes, I am at par with the others. Because today he may have to take loans, he may neglect his diseases, but tomorrow when this is in applicability, this patient of mine will take those benefits and will realize in a later what is the benefit of this insurance. And this is not limited to the government hospital. We will impanel the private hospitals. These patients will be at choice to take their services because a package system will come in force. The package system will further lead to reduction of the rates. In today's market, if the rates seem to be higher to them, but when the package comes into existence, these rates will come down. Because if I am not impaneled hospital and my rates are high, no patient will come to, because the impaneled hospital will make the rate as it is for the general public also. So this way the cost reduction will also come. And with the commitment of the Prime Minister in the flagship programs of 100% immunization, I am very optimistic this country will shortly find all children immunized.
Can you just allow me?
And a Tandurust Bharat will come up.
Thank you for sharing this insightful info on academy. Thank you so much, sir. Thank you.